Hello, Pathways. Welcome to Compliance in 15 Minutes. Let's review the standards that Pathways follows to comply with local and federal laws. In complying with and monitoring these standards, Pathways demonstrates that we can be trusted to provide excellent services, and in turn, we get reimbursed. Some of the regulating bodies whose standards we follow include the U.S. Department of Health and Human Services, the Center for Medicare and Medicaid Services, the U.S. Department of Veterans Affairs, and the D.C. Departments of Behavioral Health, Health, and Human Services. Compliance trainings can come with a lot of jargon and acronyms. Whoa! But don't worry, we'll review these as we go along. Today's training will cover two main topics, privacy and security. First, we'll review federal and local privacy regulations that protect health information. Next, we'll review regulations and Pathways policies that ensure client records are documented accurately and stored securely. If your team provides ACT, community support, psychiatric, or supportive employment services, you'll also want to review compliance standards for Medicaid billing. These are outlined in a separate training offered monthly at Q Street. For now, sit back, relax, and allow yourself to reflect on what brought you to Pathways. Was it your commitment to ending homelessness? Your desire to promote social justice, health, and recovery? I can bet it wasn't because you wanted a long list of rules to follow. It's our goal that this training will clarify the rules we follow, while giving you examples of how compliance ensures that we are honoring the neighbors we serve, protecting their privacy, and promoting recovery. Complying with these rules ensures we are providing excellent and ethical services. Let's get started. Rules about disclosing client information and maintaining client records are included in HIPAA. Our first acronym. These rules outline how we all play a role in keeping health information private and storing it safely. HIPAA applies to all healthcare professionals nationwide. At Pathways, we also comply with all DC regulations and agency policies. Privacy standards apply to all protected health information, whether shared in conversation, in writing, or electronically transmitted. Privacy standards are about who has the right to share and receive, what protected information is shared, and when they have the right to do so. So what is protected health information? Protected health information is clinical information that identifies an individual and is maintained or transmitted by a care provider, like Pathways. Protected health information includes a client's name, diagnosis, services received, or anything that traces a person back to being a client. Extra care must be used when talking about a client in a public area, photocopying ID cards and faxing prescriptions, or handling discharge papers and forms with the client's name, address, or date of birth. Notice that even a hallway conversation between two clinicians about someone's care can be considered confidential. While HIPAA was created to protect the privacy of patients, it recognizes that it is important to coordinate care and share information in certain environments. People do not exist in a vacuum, so there are times when it is necessary to share information with designated family members, team members, or with other providers to coordinate care. Local DC regulations have clarified that you can legally disclose health information if you, as a mental health professional, believe it is necessary for emergency hospitalization or to protect the client or someone else from serious risk of imminent physical injury. This law permits disclosure of protected health information without signed consent to a select group of individuals in the event of emergency hospitalization or protection from imminent serious bodily injury. These include the client's spouse, parent, if a minor, or legal guardian, an officer agent or accredited agent of the District of Columbia in charge of public health, the Department of Mental Health, a provider, be they an individual or an agency that is licensed or certified to provide mental health services in the District of Columbia, the District of Columbia Pretrial Services Agency, the Court Services and Offender Supervision Agency, a court exercising jurisdiction over the client as a result of a pending criminal proceeding, emergency medical personnel, an officer authorized to make arrests in the District of Columbia, or an intended victim. This may seem like a long list, but let's remember, Any disclosure of mental health information under this DC statute must be limited to the minimum amount of information necessary to initiate or seek emergency hospitalization or to otherwise protect from a substantial risk of imminent and serious physical injury. What this means is that any other information that you are interested in sharing to anyone else, including those parties we just listed, requires a signed release of information. The HIPAA privacy rule also gives guidance on the balance between keeping information private and sharing it in approved contexts in order to provide the best treatment possible. Let's go over this guideline now. In order to protect patient privacy, HIPAA requires that healthcare providers ask permission before sharing any information with others outside of the treatment team. At Pathways, this is presented as a release of information, signed by the consumer and stored in their electronic health record. You can find it in Credible under the visit type Release of Information. Using your iPhone, you can even have the client sign electronically. Under federal regulations, a patient can give verbal consent. Verbal consent, however, is limited by local regulations. Local privacy regulations under the Department of Behavioral Health only permit verbal consent when sharing protected health information to anyone inside the Department of Behavioral Health provider network.
In DC, there is one exception to this release of information requirement. If you are sharing information with another DBH-covered entity to coordinate care, you do not need a release of information. Remember, you are still expected to only share the minimum amount of information necessary to coordinate care. However, no release of information is needed. These covered entities include sharing with DBH, St. Elizabeth's, CPEP, Mobile Crisis, and other DBH core service agencies.
When in doubt, ask and document with the client's signature. Consent forms and release of information authorizations must include an expiration date or expiration event. The event can be upon termination of treatment. However, it is recommended that authorizations are reviewed each year. The HIPAA privacy rule also protects the rights of the client. Clients have the right to ask and see a copy of their health records, have corrections added to their health record, and receive a notice explaining how their health information is used and shared. Let's get into that a little more. Clients have the right to decide if they want to give permission before their health information can be used or shared for certain purposes, such as marketing. Clients have a right to get a report on when and why their health information was shared. Clients also have a right to know any time their health information privacy was breached. An example of this might be when an unencrypted tablet, smartphone, or laptop with unprotected client information is stolen. Finally, clients have a right to file a complaint with their provider, insurer, or the U.S. government if they believe that their rights have been violated. HIPAA privacy regulations apply to clients, even after their death. This means that we need to honor the privacy requests and consent permissions of a consumer, regardless of their treatment status. If the individual asks for certain information to not be disclosed, then it should be kept private from those the deceased client chose to exclude. For the list of exceptions to this rule, please contact the Director of Quality Improvement. Before we move on to HIPAA security regulations, go ahead and take a few seconds to jot down any questions related to the privacy regulations we just reviewed. These can be directed to your manager, team leader, or a member of the Quality Improvement team. Security regulations. When reviewing the HIPAA security regulations, let's start with the basics. What is the clinical record? Clinical records are legal documents. They are often referred to as the electronic health record or electronic medical record. The clinical record can include electronic, paper, and scanned records. We partner with Credible Behavioral Health to provide an online electronic health record that is secure and easy to use. When clinical records involve Medicaid and Medicare billing, they are considered part of a client's legal medical record. According to HIPAA, reasonable steps must be taken to protect the security of these records. To help us keep client information safe, every consumer enrolled for services at Pathways DC has an electronic clinical record in Credible. Veterans also have documents stored with Homeless Management Information System, an electronic record-keeping system from the Veterans Administration. Our electronic health record, Credible, has features to help keep protected information secure. One of these features is the automatic logout function. When a provider has been idle and credible for 15 minutes, the system automatically logs you out and requires you to re-enter your password to return to screens with protected information. Another security feature in our electronic health record is its password protection. Each user has their own username and password. Remember, do not use a password that would be easily guessed, like 12345, or the same password for all your electronic devices. In some cases, a password will be provided to you from a member of the tech department. To further safeguard privacy, staff should use client initials and avoid using other identifiers, like date of birth, social security numbers, or e-Kira numbers in emails and cloud-based documents. Additionally, all staff email accounts must have a disclosure statement at the bottom of their email signature, explaining that the contents of the email may contain protected health information. For help with setting this up, email onsitesupport@pathwaysdc.org. Pathways desktops are also password protected and require staff to regularly change their network password. Private client information should never be kept in an unlocked drawer, in a vehicle, or anywhere other than a unique file labeled for that client and secured in a locked cabinet. Paper charts used to complement the electronic health record should be kept in locking file cabinets or in a locked file room on site. This keeps protected information confidential and secure. At Pathways, we have a locked file cabinet in the medical suite, where files waiting to be scanned into electronic documents can be stored. In compliance with HIPAA regulations, there is one file for every consumer, and the cabinet is kept locked and in a locked office. Just as written documentation shouldn't be stored in public areas, Pathways staff must use caution when viewing electronic information in public places. All electronic devices used must be password protected and should have screen protectors if used in the community to read protected information. Pathways electronic records and storage policy allows original paper documents to be converted into scanned electronic files. Staff members scanning and uploading files into a client's record or profile in Credible must open the scanned document and verify that it is identical to the paper record before shredding the original paper document. Fax machines can be particularly risky when it comes to HIPAA security. Fax machines must be checked regularly throughout the workday to ensure that no protected information is sitting in a public area. Any paperwork that includes identifiers such as a client's name, date of birth, address, or ID numbers must be filed away as soon as the provider is finished reviewing it. In other words, if you have paperwork with client information on it, it must be filed away into the client's individual file in a locked cabinet or scanned, uploaded to Credible, and shredded immediately. Now that we've reviewed security regulations, take a moment to jot down the questions that have come up for you. We have an excellent team of QI staff members that can help you answer these. The last part of this training will review Pathways compliance activities and policies. It is Pathways policy that clinical records kept by Pathways staff must be organized to accurately and contemporaneously document all clinical activities regarding each client admitted, served, and discharged. Contemporaneously is a fancy word for saying that client records must be up to date, entered in a timely fashion, and reflect the most recent services provided. At Pathways, we follow a 48-hour rule to ensure that all services are documented in a timely way. By following a 48-hour rule, we are not only abiding by Medicaid timeliness standards, but we are ensuring that in emergencies, all staff working with the client will have up-to-date information in the clinical record, regardless of time of day or day of the week. Many of us work on teams providing care that is available 24/7 through on-call services. It's critical that medical records are kept up to date so that team members working on call can coordinate care with hospitals, legal services, and other providers. At Pathways, it's common to have both paper and electronic records for clients. Paperwork left in copy and fax machines are placed in a tray for staff to retrieve. This tray is then cleared multiple times each day, and unclaimed documents are delivered to the appropriate department. If unclaimed, these documents are shredded. The office has multiple receptacles for shredding. Any document that contains protected health information should be filed away or dropped into the shredding container to be shredded. In addition to paper and electronic health information, conversations may also contain protected information. Pathways has multiple consultation rooms in Building A and B so that staff working in an open office environment can have a private, secure place to meet with clients to discuss their treatment goals, diagnosis, or any other information that is private. white noise machines are available to borrow for these meetings. As we come to the end of our training, here are some of the key things to remember. Pathways follows local and federal privacy and security laws. Each year, Pathways staff are required to review these laws in this compliance training. Be mindful of these laws when you are sharing client information with or without a release of information. And last, use caution to keep information secure by storing in locked file cabinets and using password protection.